Good afternoon, dear students. The topic of our lecture is fever of unknown origin in inflammatory and non-inflammatory diseases of internal organs. Fever of unknown origin or pyrexia of an unknown origin refers to a condition in which the patient has an elevated temperature, fever, but despite investigations by a physician, no explanation has been found. If the cause is found, it is usually a diagnosis of exclusion, that is, by eliminating all possibilities until only one explanation remains and taking this as the correct one. Definition. Classic criteria of fever of unknown origin are fever higher than 38.3 degrees by Celsius on several occasions, persisting without diagnosis for at least 3 weeks. At least 1 week's investigations in hospital. At least 1 week's investigation in hospital. A new definition which includes the outpatient setting, which reflects current medical practice, is broader, stipulating 3 outpatient visits or 3 days in the hospital without elucidation of a cause, or 1 week of intelligent and invasive ambulatory investigation. The main causes of the fever of unknown origin are infections, localized, for example, endocarditis, or intra-abdominal infections, or urinary tract infections, or osteomyelitis, or maybe upper respiratory infections, generalized, bacterial, mycobacterial, viral, fungal, and parasitic infections, and endocrine diseases such as hypothyroidism or thyroiditis. The cause of fever of unknown origin, one of the major causes is neoplasia. For example, leukemia, solid tumors, for example, lymphoproliferative disorders. The other cause is connective tissue disorders. And one of the causes of fever of unknown origin is Fastitus fever. Fastitus fever is further categorized as one of the possible causes of fever of unknown origin. It can be caused by a range of psychiatric and non-exciting illnesses, namely Munchausen syndrome by proxy, and various personality disorders. The patients with fastidious fever may present with topical symptoms of a certain disease and may appear to be genuinely ill. They may deliberately falsify their history, and tamper with physical findings to achieve this. This may be done for a number of reasons, such as in order to gain attention from health professionals. Individuals with fastidious fever may also change their hospital or care gives frequency. Family Mediterranean fever or periodic illness. It's the other disease, an example of fever of unknown origin. It is a recurrent disease, is a hereditary disease characterized by recurrent episodes of fever and peritonitis, sometimes with pleurisy, skin lesions, arthritis, and very rarely pericarditis. can develop amyloidosis of the kidney, which can lead to kidney failure. Most often, this disease occurs in the descendants of the inhabitants of the Mediterranean basin. The diagnosis is largely clinical, although a genetic examination is available. Treatment includes colchicine for the prevention of acute attacks, as well as amyloidosis of the kidney in most patients. Prognosis for treatment is favorable. Diagnostic criteria of it. Basic diagnostic criteria and additional diagnostic criteria. Basically, diagnostic criteria are periodically occurring diffuse peritonitis and or pleurisy from 2 to 3 days, accompanied by severe pain syndrome, fever associated with pain, amyloidosis, and positive therapeutic effect of colchicine. Additional diagnostic criteria are recurrent attacks of arthritis. Then erythroid erythema. Then onset of the disease in early childhood of puberty. National affiliations, weighted down family history, unjustified repeated surgical interventions in abdominal and mixed form, remission during pregnancy, and resampling of seizures after delivery. So, diagnostic criteria are basic diagnostic criteria and additional diagnostic criteria. Basic diagnostic criteria are periodically occurring diffuse peritonitis and or pleurisy from 2 to 3 days, accompanied by severe pain syndrome, fever associated with pain, amyloidosis, and therapeutic effect on colchicine. And additional diagnostic criteria are recurrent attacks of arthritis, erythroid erythema, onset of the disease in early childhood puberty, national affiliation, weighted down family history, unjustified repeated surgical interventions in abdominal or mixed form, and remission during pregnancy and resumption or seizure after delivery. Symptom. The main manifestation is an increase in body temperature up to 40 degrees by Celsius, usually accompanied by symptoms of peritonitis. The pain in the abdomen is noted in about 95% of patients and can vary in severity from attack to attack. Peristalsis, abdominal enlargement, muscle tension of the anterior abdominal wall, and symptoms of peritoneal irritation often develop at the peak of the attack, and they cannot be distinguished from the perforation of the internal organ during physical examination. Other manifestations include acute pleurisy in 30% of patients, arthritis in 25%, usually with knee, elbow, and hip joints, rye-like rash on the lower part of the legs, edema, and soreness of the scrotum caused by inflammation of the testicles. Pericarditis develops very rarely. At the same time, pleural, synovial, and skin manifestations of familiar Mediterranean fever vary in frequency among different populations and are least frequent in the United States than elsewhere. Complications of familial Mediterranean fever: it's chronic renal failure caused by the deposition of amyloid in the kidney. Its amyloid deposits can also be found in the digestive tract, liver, spleen, testicles, and thyroid gland. What tests are needed? General blood analysis, leukocytes, fibrinogen, C-reactive protein in the blood, alpha-1 antitrypsin in the blood, ceruloplasmin, and serum. Treatment of this periodic disease is colchicine, interferon alpha from 3 to 10 million units subcutaneously, prozazine 3 mg orally 3 times daily, as well as thalidomide, sometimes to ease the pain if it is necessary to prescribe opioids, but you should carefully approach their purpose so as not to become addicted. The other causes of the fever of unknown origin are localized pyogenic infections, intravascular infections, systemic bacterial infections, mycobacterial infections. The other bacterial infections, such as Whipple's disease, rickettsial infections, chlamydial infections, viral infections, for example, dengue fever, Epstein-Barr viral infection, hepatitis A, B, C, D, and E, HIV infection, fungal infections and parasitic infections. And a few words about neoplasm. Malignant lymphoma is by far the most common diagnosis of fever of unknown origin among the neoplasms. So malignant lymphoma on the first place. In some cases, the fever even precedes lymphadenopathy detectable by physical examination. So, the other causes of the fever of unknown origin are, of course, hematological malignancies. Hematological malignancies, for example, multiple myeloma, for example, non-Hodgkin's lymphoma, plasmacytoma, for example, systemic mastocytosis, solid tumors. Most of the solid tumors and metastases can cause fever. Those most commonly causing fever of unknown origin are breast, colon, hepatocellular, lung, pancreatic and renal cell carcinomas. And also sometimes benign tumors can cause fever of unknown origin, for example, such as atrial myxoma or necrosis of dermoid tumor in Gardner syndrome. Systemic rheumatoid and autoimmune diseases can cause the fever of unknown origin. For example, gout. For example, connective tissue diseases, reactive arthritis, rheumatoid arthritis, etc., etc. For example, Vogt-Koyanagi-Harada disease. Vasculitis can be the cause of the fever of unknown origin. For example, Kawasaki disease, polyarthritis nodosa, Takayasu arthritis. The types of allergic vasculitis can cause the fever of unknown origin. Granulomatous disease, autoinflammatory syndromes. Talking about thermoregulatory disorders, we can have central and peripheral thermoregulatory disorders with the development of fever of unknown origin. Central, it is brain tumor, for example. It is encephalitis, cerebrovascular accident, hypothalamic dysfunction. And peripheral, for example, pheochromocytoma, the well-known pheochromocytoma. Diagnosis. Ultrasound to diagnose the fever of unknown origin. Ultrasound, it's necessary to do. Ultrasound may show cholelithiasis, for example. Echocardiography may be needed in suspected endocarditis. CT scan may show infection or malignancy of internal organs. Gallium-67 scanning, which seems to visualize chronic infections more actively, and invasive techniques such as biopsy and laparotomy for pathological and bacteriological examination may be required before a defined diagnosis is possible. A positron emission tomography using radioactively labeled fluorodeoxyglucose have been reported to have a sensitivity of 84 and a specificity of 86 for localizing the source of fever of unknown origin. So positron emission tomography. Despite all this, diagnosis may only be suggested by a therapy chosen. When a patient recovers after discontinuing medication, it likely was drug fever. Or when antibiotics or antimycotics work, it probably was infection. Empiric therapeutic trials should be used in those patients in which other techniques have failed. So, classic fever of unknown origin. And to conclude about the classic fever of unknown origin, there are 5 categories of conditions. First one, infections. The second one, neoplasms. For example, lymphomas and leukemias. The third one is connective tissue diseases. The fourth one is miscellaneous disorders, and the last one fits its undiagnosed conditions. Conclusion: infection, systemic autoimmunity, inflammatory disease, malignancy involving the reticular system and tumors of the liver and kidney are common causes of the fever of unknown origin. On rare osseous tumors of the gastrointestinal tract can also cause fever and often in a sporadic fashion. An early facial analysis for occult blood should be undertaken if the cause of an fever of unknown origin remains elusive after conventional. And in situation, what it's necessary to do? It's necessary to follow the fever of unknown origin protocol of investigations. And thank you for your attention.